Topic is pigmented swelling in the skin. Last topic, pigmented swelling in the skin. Hello students, we'll discuss a swelling in the skin or subcutaneous tissue which is pigmented lesion with the swelling in the skin and subcutaneous tissue. Just see what is this condition is. You can see that it's a pigmented lesion with the swelling underneath. You can see pigmented lesion here. You can see the swelling underneath like this. So this is a very typical thing, and differential diagnosis is it may be punctum. It may be punctum of the sebaceous cyst. It's a quite large mass. Usually it is a small dot. It is a larger one, or skin adnexal tumor or melanoma. So this is the differential diagnosis. You have other pigmented condition also you have to keep in mind. And so important thing is check the surface, check the mobility, skin pinchable or no, skin may not be pinchable here. And mobility in two direction. Always when you check a swelling, mobility in two direction you have to check. And fixative check if there is a muscle and contact the muscle and check the mobility. Drainage lymph node should be examined, and systemic examination if you are thinking it is malignancy. So these are the important things you have to remember when you do the examination in this patient. That's why it is important. And treatment is, if it is simple thing, excision under local anesthesia. But very again important thing is always send it for histology. Never throw the specimen. Always any tissue you have removed, send it for histology, because sometimes you may miss malignancy in such situation. It will be offense legally also, but an injustification to the patient. Always send it for histology. And if it comes as a malignancy, then you have to do wide local excision under anesthesia for the clearance. Then if it is a lymph nodes are there, you have to do a lymph node dissection. Then you may have to, depending on the type of malignancy, maybe melanoma or other thing, then you may have to give chemotherapy, you may have to give immunotherapy. Depending on the type of malignancy, you have to decide what exactly. Adjuvant therapy, that surgery and adjuvant therapy and follow-up. The three things are very important in any malignancy. So wide local excision, lymph node dissection, and adjuvant therapy. In that, chemotherapy, immunotherapy, radiotherapy, all those comes. If it is melanoma, no radiotherapy, chemotherapy and immunotherapy. Melphalan, DTIC, all those things are given. And immunotherapy also very, very useful in melanoma. So this is the important thing is whether it is benign or malignant to differentiate, think, and excision and send it for histology. If it comes as a malignancy, wide local excision, lymph node dissection, further treatment. If it is benign, you are through. That's the point you have to remember. That's why this is important to think different conditions in these patients. It's the most important thing I wanted to stress actually. So all these things you have to do, then adjuvant therapy, I already told. So go through my manual of surgery for detail about the skin tumors. It will give very clear idea, and also swelling. Everything about swelling and skin tumors is given in my book. So always go through my manual, have that book and go through that. And also, so students, please subscribe my YouTube channel with your friends and students, like it, and it will give a lot of information, daily update your surgical topics, brief lectures, and also you have live sessions once in week or 2 weeks, which will be very, very useful with interactive sessions of clinical examination and different case scenarios. And different professors will also join that, and you'll have a certificate if you join live session. Also, it will be very, very useful for your YouTube, for your future career. Like it and share with your colleagues and friends for your increase or upgrade your surgical knowledge on day-to-day basis. Answer the MCQ. Melanin is interested in ABCD. Put the right answer in the comment box. I'll acknowledge your answer. Answer the another MCQ. Merkel cell carcinoma is arising from ABCD. Again, put the right answer. I'll acknowledge your answer in the comment box. Quotation of the day is: life begins from a seed, later sprouts, and eventually blossoms. At the end, it dies. That is a life actually. Look at a small seed, how it goes and dies. Same thing also for human beings. It's not different. It is exactly says it's a very, very important quotation, how life happens and eventually ends for everybody. So students, again, I request subscribe my YouTube channel, like it and share it. So students, I hope you understood this lecture very well. Thank you so much.